Good morning, everyone. Good afternoon, good evening from wherever you're tuning in for this 2023 Engage Africa Foundation Festival on non-communicable diseases awareness, education, and prevention in the African continent. My name is Nagede Ade. I am a health systems analyst. And today, my presentation will look at the important role of the health system in curbing the NCDs epidemic in Africa. So the content of this presentation, first we will start with defining the concepts. What is a health system? We will look at the epidemiological profile in the African continent, specifically the change in disease profiles from communicable to non-communicable diseases, which are on the rise. We will then look at the risk factors for NCDs, sort of necessary to set the stage into understanding how the health system can intervene to reduce the epidemic by reducing these risk factors. And then we will end through some concluding key messages. So, what is a health system? A health system consists of all the organizations, institutions, resources, and people whose primary role and purpose is to improve health. The health system delivers preventive, promotive, curative, and rehabilitative interventions through various mechanisms, including public health actions and through health facilities. The myriad of health facilities at the community, district, and national levels. A health system needs to be responsive to population needs. And for it to be responsive, it needs to have a couple of components or elements. So the health system will be responsive if it is effectively governed by national strategies and policies, if it has an adequate health workforce, including community health workers, nurses, doctors, lab technicians, and you name the rest, if it has an integrated health information system to collect, analyze data on population health needs, population's access to health services, and population's preferences. It would also be responsive to population health needs if it has a sustainable and equitable health financing model to ensure that the health system can deliver the promotive, preventive, and rehabilitative services it needs to deliver to its population. It would also need to have a strong health infrastructure with health commodities and equipment throughout the country, so with a strong geographic coverage. And lastly, it would need to have a strong health service delivery model, meaning that it should be able to provide health services to the population as close to them as possible, to where people live. And access to health services shouldn't be deterred by geographic barriers or even financial barriers. The health services need to be delivered as close to people as possible. So this is the components of a health system, sort of like the hardware of a health system. It needs to have all of these elements or components in it. Moving on to the next slide. Aside from these hardware components, the health system also needs to be organized and managed in a certain way to be able to respond to population's health needs. So it first needs to focus on prevention and health promotion. So when we talk about people-centered health systems, it really means that the health systems need to be focused on people. So aside from having these components of governance, strong health service delivery, health financing models, they need to be organized and delivered in such a way that people are at the center of it. And there's a consensus that by adopting a people-centered approach, then the health system will be more ready to meet the healthcare needs of populations. So people-centered health systems essentially mean that the health system has a strong focus on prevention and health promotion to ensure that it's not overburdened with just curing and financing. It's not skewed towards just curing, but also preventing diseases and health and giving health promotion programs to prevent diseases. The services, as I mentioned before, also need to be delivered close to people as possible and with them as decision makers, where the population participates in their own health and are decision makers in their own health. The health system, a people-centered health system built on local and context-specific solutions to the local problems that exist in the country. And also, a people-centered health system adopts a multi-sectoral whole of government and whole of society approach, which means that the health system works with other sectors. It's not just limited to the healthcare system or the Ministry of Health, but it works in collaboration with other line ministries that have and that play a role in improving health. And we're talking about the Ministry of Education, Ministry of Finance, Ministry of Food and Agriculture, Family Planning, all these other ministries. So now that we have defined the concept of the health system and that we know what a people-centered health system is, now let's look into NCDs, the changing profile of NCDs in the continent and how the health system can play a role. So this table shows us sort of like it puts together, first of all, in 1990, the main causes of death in the African continent, and it ranks it by the main causes of death. And then we look at it through the lens of 2015 now. So how have the main causes of death changed over this span of time? In 1990, we see that one of the top 10 causes of death in the continent were malaria, diarrheal diseases, lower respiratory infection, tuberculosis, measles, protein energy malnutrition, ischemic heart disease, hemorrhagic strokes, HIV, and others. And over the span of 2 decades, in 2015, close to 2 decades, we see here that the disease profile and the main causes of death have changed, where ischemic heart disease, hemorrhagic strokes, and diabetes have taken a higher rank. What this implies is that more people are dying of ischemic heart diseases, hemorrhagic strokes, diabetes, and other NCD diseases in 2015, and more people will continue to die of these causes as compared to in 1990. So we're actually seeing a situation where the health system will be burdened not only with, of course, the communicable diseases which are still present, but also the rising trend of deaths from non-communicable diseases. The health systems needs to be ready. The health system needs to be equipped to address this trend and this change in epidemiological profile of deaths. So what are some of the risk factors of these NCDs? What are causing more deaths from these NCDs and more disabilities as well from these NCDs? We can group them into 3 broad factors, genetic factors, of course, behavioral factors, and socioeconomic factors. It has been proven that excessive alcohol consumption, smoking, a sedentary lifestyle, and unhealthy diet are the main causes of like some of the biggest NCDs that are currently existing. So hypertension, strokes, cancers, diabetes. These are caused by some of these behavioral factors. So excessive alcohol consumption, excessive smoking, a sedentary lifestyle, and unhealthy diet. And of course, these behavioral factors are influenced and are shaped as well by the socioeconomic environment in which people live. Poverty. Poverty can lead to more people having smoking, alcohol consumption, adopting a sedentary lifestyle or eating unhealthy, poor living conditions, and also policies within the country that do not dissuade or that enable some of these sedentary and behavioral factors. And so all these merge together to lead to more deaths from NCDs. So for the health system to be able to respond to the rising trend of NCDs, they have to address some of these risk factors head on, and they have to be equipped to support or create an enabling environment which can support people in changing their lifestyles, in having access to more healthy foods, having access to more physical activity, training more, doing more sports, having access to programs that can support them in reducing the levels of smoking or the levels of consuming alcohol. So let's start off with, okay, there's something missing here, but that's okay. Let's start off with the role of the health system in terms of governance. We see here that the health system needs to ensure that it has adequate and appropriate non-communicable diseases policies and strategies in place, and that these policies and strategies are part of the national health development plans that are being implemented. So countries usually have these national health development plans, which are developed through a multi-sectoral approach, and that usually spans a number of years, 10 years sometimes. And these plans have an associated budget. So it will be important for the health system to ensure that NCD policies and strategies and priorities are included in the national health development plans so as to ensure that it becomes a priority for the government. And also to ensure that it has a budget associated with it. And by having a budget associated with it, then these plans are more likely to be implemented with various actors and are therefore more likely to address the rising trend of NCDs. So these policies will need to focus on preventive and health promotion strategies. They're sometimes called the best by interventions developed by the WHO. And these plans and policies will need to be costed and have an associated budget with it. The governance structure of the health system needs to ensure that it spearheads a multi-sectoral approach. So there's multi-sectoral collaboration with other government ministries. This could be through having regular coordinating meetings with other sectors to implement the policies and strategies that have been developed to address NCDs. So for example, meetings with the Ministry of Education to develop broad national public health campaigns on, for example, the negative effects of smoking, or public health campaigns on the benefits of physical activity with the Ministry of Sports. The Ministry of Health would collaborate as well with the Ministry of Food and Agriculture to ensure awareness on the benefits of healthy eating and avoiding unhealthy foods such as high salt intake. And we'd also need to work with this ministry to ensure that there is limited trans fat in foods in the industry. The Ministry of Health would also have to work with the Ministry of Youth and Urban Planning to ensure that the environment is fit to support people to do more physical activity. Of course, this is not just limited to line government ministries. The Ministry of Health will need to work hand in hand and in collaboration with community leaders, civil society organizations, academic institutions such as universities, the media, also the private tech sector, and other development partners to ensure that the evidence-based strategies on reducing NCDs are being implemented at country level. And last but not the least, the Ministry of Health would need to work with Parliament, of course, to ensure that the regulatory environment is set, such as bans on tobacco advertising, bans on alcohol advertising at certain hours, and even bans on unhealthy food advertising. There is a section that is missing there, but it was really about collaboration at continental level. Here, the health system, we need to ensure that the health systems of different countries in Africa need to collaborate together. So the Ministry of Health will need to collaborate with other ministries in other countries. They will need to build collaborations with other universities in other countries to learn from what other countries are doing, to learn from the strategies that have worked in other countries, and potentially also share resources that could be used to train healthcare workers in screening and sensitizing on the NCDs. Moving now to the next aspect of the health system. Oh, there it is, cross-regional and continental initiatives for large-scale impact. Now, in terms of the health systems and the health workforce, the health system will need to be ready in terms of adequate human resource and health workforce to address the NCD epidemic. And at the continental level, I mentioned this, we will need to build, the health systems will need to build collaborations for cross-country exchange of training materials and resources for healthcare workers. At national level, the health system needs to be ready to train and to train community health workers with the knowledge and tools to promote NCDs awareness and promote appropriate behaviors to address NCDs. The health system would also need to train doctors and nurses to routinely sensibilize patients on NCDs and its preventive factors. There's a strong component on awareness building, which is quite important because education is key here. And the health system will also need to train nurses, doctors, and even community health workers on the early detection and treatment of NCDs. The early we detect certain risk factors that could lead to, like hypertension, for example, that could later lead to certain diseases. The early we detect that, the early we treat it, then the less it will become a bigger impact and burden on the healthcare system. Such as early screening for hypertension and diabetes. And also, and importantly, the health system will need to be able to obtain feedback from the population, from patients, to feedback on their experiences with the health system, with accessing these services, to be able now to improve on these NCD policies and strategies and be able to respond more to population's needs and preferences in terms of NCDs prevention. At community level, of course, the health system will need to be ready to make use of the population, community groups such as women's and men's groups, youth organizations, religious leaders, even social media influencers, to pass on these key health promotion and prevention campaigns and messages. Now we're going to move on to the important role of health financing of the health system to address NCDs. So the health system would have to be at the forefront in spearheading innovative strategies for financing NCD prevention programs through, for example, the taxation of tobacco products and alcohols and sugar-sweetened beverages. And these, the taxes from these products could then be injected back into the health system to be able to finance some of the programs we've mentioned, anti-smoking programs, some of the public health campaigns at national level that would need to be put in place. The finances from taxing tobacco unhealthy products could then also be used to train healthcare workers to sensibilize the population and to screen and early detect early these diseases. And so the health system would also need to ensure that NCD prevention programs and services are being funded through the national health insurance schemes in certain countries. So many countries in Africa now are thinking about universal health coverage, and one way to move towards universal health coverage is through implementing the national health insurance scheme. And so it's going to be important that priority non-communicable diseases prevention strategies and services are being funded through the national health insurance scheme, so people have access to these services, have easy access to these services without the burden of having to pay. And of course, the availability of essential medicines and products is key within the health system. And so the health system would also need to ensure that through an adequate and sustainable financial model, it has a necessary available stocks of certain drugs to prevent heart attacks or strokes, and that some of these medicines are added within the Universal Health Coverage Essential Medicines list. For example, hypertensive medicines are added within the UHC Essential Medicines list so that people can have access to these when they need it and without going through the burden of having to pay for it. The health system will need to create anti-smoking, anti-excessive drinking counseling programs, both at community and health facilities levels, to be able to support individuals who need the help to reduce their levels of smoking and drinking, and thereby reduce the incidence of NCDs. Of course, research is currently showing that there are some that hepatitis B vaccines have been associated, low coverage of hepatitis B vaccines have been associated with some cancers. So the health system will need to scale up immunization coverage for some of these vaccines to prevent certain cancers. And of course, the health system will need to have available high quality screening equipment at community and health facility level for the early detection of NCDs. So for example, having appropriate and quality tools to detect or to screen for hypertension will be necessary for early detection and treatment. Having all these elements is important, including a strong health information management system to be able to monitor the prevalence of NCDs at country level. So the health system will need to ensure that its health information management system is strong enough and it has within it certain national indicators and targets to monitor progress on NCDs, both its prevalence, but also monitor progress on the availability and use and access to NCDs or prevention strategies and cure. And so some of these indicators will need to be added within the district health information system and available in countries. The DHIs too would also need to be able to monitor population's awareness of NCDs and annual performance reviews of the health system will need to be conducted to ensure that the health system is actually ready and is being well equipped in addressing the rise of non-communicable diseases. So this is really about the health information system having the data, following the data, and being able to act on the data. And the data obviously includes many things. This data includes indicators on the prevalence of NCDs, data on the level of access to NCD prevention programs, the data on the availability of tools to support the health system to implement these NCDs policies and strategies. And of course, this data would need to come both from the public health facilities, but also the private health facilities, because a lot of the population sometimes use private health care. So the broad health system will need to ensure that data is being collected both from public and private health facilities. Last but not the least, the health system will need to have adequate service delivery models, as mentioned prior. So the health system will need to spearhead regular public health promotion national campaigns through mass media to improve awareness and education. Information is a determinant of health, so this is quite key. The health system will need to ensure that health services to prevent NCDs are really as close to people as possible. So within where they live, within their communities. And so the role of community health workers will be key here to support early detection and early management, including even within community pharmacies. And of course, the health system will need to have in place adequate referral systems for the continuity of care. So from detection of NCD risk factors like hypertension at the community health facilities or the community level through primary health care, then to secondary health facilities at a district level or to tertiary health facilities at the national level. So it will need to ensure that there's a continuity of care there. And again, potentially also through the National Health Information System, through medical electronic records to follow the patients through this level of care. And of course, it is important, again, as I mentioned, the building blocks of the health systems are present, but then they need to be implemented and delivered in a way that is people-centered and in a way that adopts a multi-sectoral approach. And so multi-sectoral action for NCD prevention will be key here. And the Ministry of Health has a key role to spearhead and to be the leader in working with other ministries, such as the Ministry of Finance, to ensure that regulation is in place and legislation is in place to tax unhealthy products, tobacco, alcohol, and sugar, and the money from these taxes are injected back into the health system to be able to implement programs. The Ministry of Health would have to work with agriculture, for example, to support the promotion of local varieties of fruits and vegetables for healthy eating. The ministry would have to work with the food industry to ensure that only healthy foods are being advertised and marketed. The ministry would have to work with the education sector to promote physical activity among school children, but also among youth and adults. The Ministry of Health would have to work with the social protection sector to ensure that that health services are NCD health services are available through the national health insurance schemes, or even that conditional cash transfer programs are being used to support certain families who need those. The Ministry of Health would also need to work with the Justice Department to enforce regulations on anti-air pollution legislation, for example. The ministry would also have to work with the Science and Technology Department or ministries and to leverage the use of the tech sector in the digitalization of health access, health information access. The ministry would have to work with the environment to regulate indoor and outdoor air pollution, water and sanitation to improve water and sanitation networks to prevent diarrheal diseases. The ministry would have to work with the information and media to ensure the broad-based dissemination of key messages on healthy eating, on the negative effects of smoking, on benefits of physical activity. The ministry will also have to work with the Ministry of Interior to enforce, for example, seatbelts and helmets to reduce road traffic injuries, and the private sectors to ensure that occupational health and work safety policies are in place and are being implemented. So this is a broad-based agenda that the ministries would have to spearhead and take leadership on to have a chance at actually reducing the rising epidemic of NCDs and reducing the burden that this could cause on the health system if not addressed. So this brings me to the end of my presentation, and I will just conclude with some key messages that we have discussed here. So first of all, people-centered health systems do have a role to curb the rising trends of NCDs in Africa. It is a possibility and it has an important role to play. Strong governing structures will need to be in place through the implementation of NCD policies and strategies in collaboration with other sectors. There will need to be a focus on public health actions through national awareness campaigns and bringing health promotion and screening services for early detection of NCDs as close to people as where they live. More health workers will need to be trained to be able to disseminate health promotion messages, prevention strategies, and early detection, like community health workers, nurses, and doctors. The National Health Information Management System will need to be strong and we need to incorporate indicators on NCD monitoring and indicators to monitor progress in reducing NCD risk factors, and also indicators on awareness, population awareness of NCDs. Last but not the least, NCD services and medicines will need to be added into the Universal Health Coverage Essential Package of Health Services to ensure that there is sustainable financing and access to these preventive and health promotion strategies and services. So this brings me to the end of my presentation. To get more information about this, there's a reference list here that you can read. And thank you so much. And I hope you have a good rest of the presentations in the Engage Africa Foundation Festival. Thank you. Bye.